Nurses are tonight preparing for their first ever UK-wide strike in a bitter dispute over pay. The walkouts, which are expected to start within weeks, will seriously disrupt NHS care. But emergency units will still be staffed. The Royal College of Nursing says its members are angry that the government has refused to increase its pay offer made in July. And the industrial action comes just as winter is about to bite and is set to worsen the already record waiting times for operations. Tonight, many patients will be fearing even longer delays. Here's our health editor, Emily Morgan.
They are said to have kept the NHS running during the pandemic. They've been praised for ensuring the service doesn't ever crumble. They are also about to enter the busiest winter of all time. But they say they are under pressure, underpaid, and are now walking out. Nurses like Sam, who works as a children's nurse. As she got ready for her shift this morning, she told me it's sometimes unbearable.
Do you sometimes dread going into work?
Yes.
Sam says she reluctantly voted to strike because low pay is driving her colleagues out of the profession.
For many of my colleagues, the conversations about can they fill up the car to get to work. You've got a number of NHS trusts now setting up food banks for their staff. The fact that that is happening for professional groups of people is abhorrent.
That's a reality, is it? That really happens, nurses going to food banks. You see that happening?
Yes, and a lot of hospital trusts are now setting up internal food banks so that nurses who are working shifts can access them.
Nurses will walk out in 176 NHS trusts or health boards that have met the requirements to strike. All trusts in Scotland and Northern Ireland are striking, 12 out of 13 in Wales. And in England, staff at some of the biggest trusts, including Guy's and St Thomas's, Great Ormond Street Hospital and Bath NHS Trust, will take action. The RCN wants more than the 4% pay rise the government is offering.
What you're asking for, though, is 5% above inflation. I mean, we're talking about 15, 16, 17%.
When you think of nurses' pay, fallen 20% behind in real terms over this last decade. So we want those nurses to be paid back what they're rightfully owed.
That's 6% of the NHS budget. You're not going to get that.
And what happens if we don't? What do we just continue on with another 47,000 vacancies?
Why are you doing this now, though? I mean, we're going into winter. It's the busiest time for the NHS. Surely you're going to put patients' lives at risk.
There's never a good time not to listen to nurses, and the government should have listened before now.
The effect on services the government hopes will be minimal.
Emergency services will be staffed, and that's hugely important. In terms of the impact, this will vary from trust to trust. Not every trust supported the ballot action, so we need to look at our contingency planning.
Sam left for work this morning not happy with having to strike, but hopeful their message might finally get through.
Well, Emily, we heard there the union, the RCN, saying that the impact on patients will be minimal. Is that really the case? Can it be the case?
Well, and I think it depends on who you are and where you are. Nurses in A&E and intensive care will not be striking, so if you're a patient who needs emergency care, it won't really impact you, but it will impact those who need routine care. So elective operations are no doubt going to be postponed and cancelled. So if you're one of the 7 million people on a waiting list, it is going to impact you and it will be frustrating. And also not every trust is going to be striking, so it depends on where you live and what hospital you attend. We don't yet know when these strikes are going to take place. That is still to be negotiated. In Northern Ireland, there's a law that states the action has to take place within a month of the ballot closing, so it will happen before Christmas. For the rest of the UK, it will probably also be before Christmas and they need to give 2 weeks' notice to the NHS. The RCN say they're still open to call this off. They're open to talk to the government, although no official roundtable talks have actually taken place yet.
OK, Emily Morgan, thank you. And if you want to find out, and you'd like to find out if strike action is going to affect your local NHS trust, you can visit our website, itv.com/news.